Welcome to the Ticktective podcast and video series, a program of the Bay Area Lyme Foundation, where our mission is to make Lyme disease easy to diagnose and simple to cure. I'm your host, Leah Gertner, Director of Education and Outreach. Lyme disease is the most common vector-borne disease in the USA and is a global issue. This show includes interviews with the researchers we fund, as well as other interesting people in the Lyme scientific community. We are a nonprofit foundation based in Silicon Valley. Thanks to a generous grant that covers all of our overhead, 100% of all donations go directly to support research and prevention programs. You can find out more or donate at bayarealyme.org. Thank you, Kerry Lang, for joining us today on the Ticktective podcast and video series.
Thank you for having me, Leah. I'm really excited to be here.
Kerry Lang, LMHC, is a Wellness and Mental Health Program Manager at the Harvard Spalding Dean Center for Tick-borne Illness. She also manages her own private practice for mental health counseling and art therapy in Boston, where her focus is on helping those with chronic illness. Kerry was first diagnosed with Lyme disease in 2010, and she has been an activist in the community since then. She runs support groups for Lyme disease and COVID Longhauler patients, and she is the mental health chair for Invisible International and Ride Out Lyme. So Kerry, I wanted to ask you how your Lyme diagnosis has informed your career.
Oh gosh, I mean, it pretty much steered my whole career, my whole life. I was an elementary school teacher when I first got really sick way back in 2009, 2010. And, I thought that was my future. I was in graduate school completing my education degree at the time and had to stop. And like many people with Lyme and tick-borne illness or many chronic illnesses, my career got completely derided. I could no longer teach and found myself asking, what's next? I actually went overseas to Abu Dhabi to teach for a couple of years, which is wild because I was like, the heat's over there and heat really helps me. And I thought the lifestyle would be a lot more calm and teaching would be easier, but that wasn't the case. So that's a funny little blip in my little story here. When that didn't work out, I took a long look at everything in my life. And I had always been interested and had always wanted to pursue a career in expressive art therapy. Was kind of too afraid, worried about the cost and, whether or not I could find a job. And I really felt passionately about the fact that I had suffered so much with very little support and that there needed to be something done about that. And so I decided to pursue my degree in mental health counseling and expressive art therapy at Lesley University in Cambridge. And lucky enough, the Dean Center opened its doors about 2 weeks after I graduated in 2015. So it's crazy how things worked out. But I try to tell my patients and those I work with, sometimes when you really follow your heart, as cheesy as it sounds, sometimes things do really work out.
And what does your day-to-day counseling practice look like? What kind of patients are you seeing?
So right now, as you mentioned, I have a private practice and I'm at the Dean Center. I go in a couple times a week right now in person because of COVID. Obviously, I'm not there every day, but we have a new program now where every patient is being evaluated not only by a physician there, but also a speech therapist, a mental health counselor, and a case manager, which is really awesome. We just do a quick consult to see how we can support them. So I do that on Tuesdays and Thursdays, and the remainder of the week, I see my patients one-on-one virtually, and I plan support groups. And I also do a lot of wellness group programming, and we do art therapy workshops, meditation workshops. And I recently just got involved with the COVID program at Spalding. So I'm working with those who have residual effects of COVID and the long-term symptoms persisting after initial diagnosis. So I run support groups with that population too.
And of course, the obvious question is, what sort of similarities and differences are you seeing between the COVID long haulers and the persistent late stage chronic Lyme tick-borne patients?
Yeah. Well, one of the reasons why I first got asked to do this support group was because the physicians were noticing such similarities in the populations. We see a lot of symptoms like fatigue, joint pain, post-exertional malaise, but also the anxiety, the really intense anxiety that comes up that seems to be a little bit more than just I'm anxious because I'm sick. It seems to be a little bit more affecting the brain, cognitive delays, memory deficits. And then we see things that a lot of people aren't even really aware of until they actually deal with it or know that somebody that deals with it. But dysautonomia and POTS, we're even seeing a lot in the COVID population too. So it's very similar in terms of presentation. I would say that some of the differences are, at least there's a little bit more societal recognition right now of the post-COVID syndrome. And it seems like they're less likely, at least now maybe, and I feel a little uncomfortable speaking for the population because I only recently started working with them. I'll preface it with that. I'm not an but it seems like the Lyme patients are more likely to venture out to the functional medicine doctors, the more holistic doctors than COVID patients are right now, because they understand that at least there's research being done and the government is also doing something about it. Whereas Lyme population for years, with a lot of people have been left to just kind of fend for themselves medically. And I guess the only other difference I would mention is that in the COVID population, a lot of people have been hospitalized or on ventilators. So we see some people that are still on oxygen and might have some post-traumatic stress from being really acutely ill. And of course, family members that have passed or been acutely ill. So yeah, there's quite a few differences as well, but a lot of similarities.
Can you talk more about what you were saying about the functional medicine treatments for Lyme patients, whereas COVID patients, you're saying, feel like they're more able to get help from the mainstream medicine?
I would say so, because I think at least it's a term, I know Dr. Fauci just gave it an official name last week, which also, by the way, the terminology of what to call these groups of people, it seems like it's going to be just as controversial, but the post-acute sequelae of COVID is past. That term just came out last week, but the fact that Dr. Fauci is coming out and speaking about it, it's being covered by the media left and right. And I do feel like there's an underlying sense that patients can at least go to their doctors and that they'll recognize it and they won't just say it's all in your head. That being said, there are some patients that still are getting that treatment still and are still being told it's just anxiety. So it will be interesting to see if they venture out towards more alternative medicine. When we see patients that are using herbalism, and of course we also see patients that are doing more controversial treatments that might not be recommended by mainstream doctors, which can be dangerous too. So
yeah, there's some pretty desperate people who have not been helped by their standard doctors. And so do you think COVID long haulers are going in that direction, or are they getting help right now? I mean, it's also new. No one really knows what's going to work and what's not going to work.
Nobody really knows. And I hope that they don't feel as stigmatized as what the Lyme population has been made to feel. And the fact that there's research already being done and funds already being allocated for this purpose, I hope that something comes of that. But it's hard to say whether or not they turn towards this. I mean, we also see Lyme patients on the more positive side of things. They really clean up their diets and find really good, healthy exercise regimens. So, I would hope for this COVID population too, that they end up learning some of these awesome mind body medicine techniques that, I personally never would have learned had I not been so sick and desperate. But I have hopes that things are slowly changing and that these two populations can really inform one another. I think that's really, I know a lot of patients with Lyme disease, including myself, or tick-borne illness, are really hopeful that this can really expose what this post-infectious illness in general could be and some clues as to how we can get people better.
It seems like there's definitely an inflammation process for both diseases, and whether the inflammation process is a result of immune shifts from the pathogen, either the virus in COVID or the bacteria with Lyme, or whether it's something that's more of a persistent infection. We don't have the answers yet for COVID. We are getting the answers for Lyme, but it's been a lot of years. But Lyme had a lot less funding, and COVID has an immense amount of funding. So hopefully these long haulers won't have to wait as long as Lyme patients who still don't have all the answers.
Right. And I really hope that something comes of the research in terms of mental health impact too, because what I really hope doesn't happen with the COVID patients is that they're just brushed off as having anxiety or PTSD when they may well have anxiety or PTSD from their experience, but that might not always explain their whole presentation in terms of mental health. We know with Lyme patients that sometimes the mental health piece is physiological, and it will be interesting to see if there's research dedicated to that.
So what are you seeing the COVID long haulers, the ones who feel better, what are they saying is helping them?
To be honest, it's fairly new. I've been doing this a few months now, so I don't want to say I haven't met many people that haven't gotten better. It's not because they aren't getting better, but it's because I'm new to this too, and it's new in general. But I do feel like there are a couple of patients that are cleaning up their diet a lot and really noticing their responsiveness to different foods, specifically sugar, and for some it's gluten too, and obviously lifestyle changes, limiting stress, and finding the right exercise regimen. And that's why Spalding is such a great place to work with this population, because they have specialized therapies like physical therapy, like occupational therapy, that can really coach patients to not push themselves, but to get enough exercise that it will be good for them and better for their illness too.
So basically, you're looking at people supporting the immune system, and that works for Lyme patients and it works for COVID patients. I mean, like, everyone can benefit from that.
Yeah.
There's
It
no.
will be interesting to see if some different immune therapies work, and different other different treatments, but yeah.
So in Lyme patients, do you find that having the support of a group is helpful for people? I hear of some people saying, "Oh, I don't want to join a Lyme support group because it's everyone sharing the hard stuff and it just makes me feel like I'm never going to get better, or
Mhm.
it just makes me more depressed." So what do you see as the benefit?
Yeah, so there's a couple things I could say about that, because I remember the first support group I went to when I was really sick. This was before I became a mental health counselor myself. There were 50 really ticked off people at this group, and like maybe 10 people spoke. I didn't even get to say my name. And it was a great group of people, great organizers, but it wasn't really run well. And that's why I use my expertise and training in mental health to run a support group really the way they should be run and the way I was trained to run them, which kind of takes away from the people that are just sharing hardships and can be really triggering for some. We do try to keep a positive spin on it as much as we can. But yeah, that being said, I do say for some people that are extremely in the throes or really mentally suffering, it's probably best at that point to get a mental health counselor. But when you're at a certain state and you want to share too and give support to others, the community aspect of getting through something like this is tremendous. And just knowing that you're not alone can be so helpful. I think a lot of people are fearful of what you just mentioned, that it's just going to put them in a worse mood or make them, more depressed to hear sad stories. But I think what ends up happening over time is people form connections and they exchange numbers and they start texting one another. They follow each other on Facebook and they find information, share information, and healing comes from that over time for sure. So I think the support groups are great, and I offer the wellness groups as kind of a side of that, because the wellness groups are where we do the meditation and art therapy. We don't do a whole lot of talking about our symptoms or Lyme. So that's why I kind of offer two of those things, so people can choose what's right for them.
Wow, that sounds amazing. I can really see how that would help because
Yeah, great.
your mental state really affects your immune system, and so having that support and being able to relax into people who understand what you're going through, whereas most people with these illnesses, the people in their family and the people around them don't understand their invisible illnesses.
Yeah, absolutely. And another point is that really being able to give back to the community and help others, even just holding the door for someone, little things that we can do throughout the day for others can also take us out of this mindset of feeling bad for ourselves or stuck in our own ways of, what we don't have and how we're suffering. So, the whole idea of coming to a support group and giving guidance or sharing even just a doctor's name or a treatment protocol with somebody else actually really does help your immune system get better, because you're helping someone, you're less focused on yourself, and it really invokes the relaxation response in the brain when you do that. So
I've seen a lot of articles around the COVID anxiety and depression epidemic, and how one of the main tenets of trying to get yourself out of that anxious and depressed place is doing something for somebody else, just doing
absolutely.
volunteering, doing anything, because
Yeah.
we all get a hit of happiness from offering something up. So I absolutely understand what you're saying.
Yeah, and finding a purpose too. I work with so many patients that it's so fulfilling to me. I think that's one of the reasons I got better. First of all, is what I do is has so much purpose now and giving back, but also seeing my patients now. I have a couple of patients that are now on the boards of Ride Out Lyme or nonprofits for Lyme all around, and it's just really amazing that people can heal through having a purpose and helping others, and it's really great to see.
And in terms of invisible illnesses, can you tell me a little bit about the work of Invincible International?
Yeah, they are a great organization. Actually, the two founders are originally from Spalding. They worked at the Dean Center a few years ago. Invisible International is really just a platform for raising awareness and educating doctors and providers on all kinds of invisible illness. But right now, they also focused on tick-borne illness too and tick-borne disease. So they have a whole platform dedicated towards educating providers on tick-borne disease, which really didn't exist to this degree before. So it's really wonderful. And we hope some big impact can be made. They also had a hackathon this year that I won, that I won an award for. And it was really exciting because it means that I'll get more support in my goal, which is actually to educate mental health providers all around the country about tick-borne illness and how we can help support this population. I'm really hoping this can spread towards those that are working with the COVID long haulers as well, because I think it's really helpful to really understand the population before you work with them. And, in my graduate school, we didn't really get any, we learned about all the different mental illness and personality disorders and everything, but we didn't really learn about all the complexities that people with tick-borne illness and complex medical issues are experiencing, especially ones that are so controversial and politicized too.
Right. There's so much new information coming out about the physiology and mental health combination.
Yeah, it's huge. Some patients might go to a mental health provider with all the symptoms of Lyme disease or even post-COVID. And it's very easy for somebody who's never heard of it or never read an article to just say, why don't you just go for a walk? Or, why don't you just start exercising and eating better? Which it's really, really tough. And I was really lucky to have some really great friends who supported me through my journey with tick-borne illness. But there's some things that can be really misguided, even with those with good intentions, just the same way the medical field is. So I think it's super important that we really have a platform to educate providers on all levels on how to work with this population. What I'd love too is to have support groups all around the country for these illnesses with trained providers, so that we know that these groups are being served and that people are really getting helped from them.
That was my next question. Do you have a resource for our listeners and viewers for if they would like to join a group that is amazing as yours?
What I typically tell people is social media can be your best friend or your enemy. I personally go onto Facebook, and if somebody's looking for a provider or something in a specific area, I'll Google that state and Lyme, and there's like 10 or 20 groups that come up. A lot of the times it's blind leading the blind. Sometimes you get people who are really mentally ill running these groups. So that can be more triggering. You also get a lot of medical recommendations that aren't great. But there's also resources I'll post in these groups. Does anyone have a mental health provider who's helped them if I'm trying to help someone find someone? And that can be helpful. I honestly don't even think support groups are a place for medical advice. Referrals to resources are great, but, and share your experience. But people really shouldn't be told what to do medically in these groups. In the next couple of years, I really hope to start doing trainings for those who want to run support groups in their area, so that they can have some tips and tricks under their sleeves and have the support they need to run really successful groups that can truly help. And yeah, stay tuned for more on that in the next couple of years as I develop that further with the help from Invisible International.
Super. Thank you so much. Well, it was lovely to talk to you. And thank you so much for helping these patients that are not often seen or understood by most mental and other health professionals. So
thank you for all the work that you do too, especially Bay Area Lyme Foundation, all the amazing research that's come out as a result of your organization too. It's been amazing. And I love reading more research. That's so hopeful.
All right. Well, have a great day.
You too. Take care.
Thank you for joining us for this episode of the Ticktective podcast and video series, a program of the Bay Area Lyme Foundation. You can find out more or donate at bayarealyme.org.